I want to make this very practical. Tonight, we've talked about medical bills. We've talked about fundraisers, delayed diagnosis, telehealth, burnout, credentialing, and the bigger role diaspora healthcare professionals can play. So for the nurse watching tonight, maybe the doctor, the CNA, the caregiver, the healthcare student, the sponsor, the vendor, or the diaspora family that has felt this burden personally, what is the action you want them to take now, Daktari?
First of all, I'm going to appeal to people in Kenya.
Yes.
Let us change our mindsets. Nobody's coming to save you. We have to be the ones to save ourselves. So let's change the mindset of waiting for people from other countries to come and save you. Let us make systems that work for us. So if we make the systems that work for us, even if somebody withdraws aid, we'll still survive.
Yes.
So and let's take ownership, because sometimes we blame the politicians that only the politicians are the ones who are corrupt. Sometimes when I go to Kenya, you park your car somewhere, the watchman wants kitu kidogo.
I know.
So it starts from down there. So
lakini wochia jalipwa surely.
Ndo angalie gari.
Angalie gari.
Yeah.
So we really have to change our mentality on everything. So if we start by that, changing our mentality and taking ownership and say, this is our country, this is our healthcare system, nobody's coming to change, it is helping us, let's do that. That's how we can be able to make the best out of what we have. And also partnership, just appealing that our Kenyan nurses and the doctors who are here, if we can come together, we can be able to actually put pressure on the government to make changes. We have the power. We can be able to do it. I know that. But if we come together, we'll be able to push so that we can use the brains that are here to make changes in Kenya. And they also should be able to welcome us. We are not enemies. We are partners.
Mulienda maju. Mulituacha hapa
we are
tukisafa.
partners. We are the same people. We eat ugali just like them.
Ugali yenye kuna accent.
Now, the other question is, like all these healthcare workers, why should they join KNAA? Why should they register for the Baltimore conference? And why should sponsors and vendors see this more than an event, but as a chance to be part of building a healthcare bridge between Kenya and the diaspora, Daktari?
So I'm encouraging our nurses to come. By the way, not only Kenyan nurses normally come to the conference. We have American nurses coming. We have they normally pay and come in actually they pay in advance than our Kenyan nurses. So I'm appealing to our Kenyan nurses to come because there's much to learn. When we are there, we are able to meet. We make bonds that help us to grow. Entrepreneurship is like one of the big things. We get time to relax. When we are there, we get time to relax because we have activities. The first conference we had, we even had massage and all that. Things to help people relax, other than education. So mental wellness. So we also, as you come, also you're going to get CEUs. So and also,
what are CEUs by there for some of those who do not
know? Continuing education units.
Okay.
So when you come, you're also learning, and more especially come and have fun. This is the only time you're going to wear your nice suits, because we are always in scrubs. You're going to wear your nice shoes and gown and shine and take some good pictures and just connect. It's just 3 days. That's your time to rejuvenate. And for the nurses who have not joined the Kenya Nurses Association, this is very important. For the first time since Kenya Nurses Association is the first organization which has been able to honor our nurses when they die. So if one of our nurses die, we come actually in uniform, and we represent. We show them that you are somebody who mattered. You are not alone. We are here for you. And we stay there. We don't only show up on that day. We are part of the fundraising. We are part of those people who cook and take the food there. This is our community. So we support each other. So this is a community where we uplift each other when we're having fun and when we have problems. We are there for each other. So it is important for the nurses who have not joined to join and more especially come to the conference. And for the vendors, you have it's a good marketing place because these are professionals. If you are a lawyer, come show us the services, legal services you can offer, because we need them. If you have, maybe you have a spa, we need that. If you have like a tour company, come. If you're selling clothes, we love clothes. We actually, most people who brought in some Kenyan clothes, they were able to sell everything last time and the jewelry they had. If you're selling homes and houses within the US, we try to keep it in the US because we don't know what you are buying in Kenya. So we keep it in the US because there are regulations.
Okay. No, that's fair. I would do the same thing.
Yeah, because we don't want to, life insurance. People are selling life insurance. We need life insurance. So there's a
IULs like Ali like.
Yeah. We need that. We need people. Nurses need financial literacy.
Yes.
Literacy, please.
Yes.
Come, teach us.
Yes.
Help us so that we don't work. Ati pesa tunaweka.
Mika is throwing jumps.
Yani Mika anatupa tu mabom zingine.
But what you said is true. Nurses especially, when it comes to financial literacy, because that's one of the things that I'm very passionate about, nurses are very susceptible.
Yeah.
Nurses are very susceptible when it comes to financial scams. When it comes to hiyo hata tutaongea baadaye, but nurses are also now, because nurses are trusted by the community, a lot of these organizations that sell these scammy products are using nurses, and the nurses are innocent because they're not trained in finance, so they're the ones who are fronting some of these products that are not necessarily very good products.
Oh,
yeah. Not about hizo baiskeli, by the way, LSSC. There was a lot of nurses who are in there.
Yes.
I don't know whether you are aware of it. Last year there was a very big scam. There was a very big scam, and there were so many nurses who were involved.
Ule jamali patikana.
But you see,
no, it was AI. There was no
jama. You see
that
nurses have money, but they don't know where to keep their money, how to grow their money.
Yeah.
So we need people who can come in and tell them the importance of having a 401k. Because you can when you are broke, you can borrow from your 401k.
Yeah.
There are things that we need. Financial literacy is actually a big one.
That is something that we're going to talk about. And you see, like Mika is joking, but it's true.
No, it is true. It is true.
Mika was saying, "My DJ wanakula
where
pesa za nurses." But there's people out there who know nurses are very busy. They're also making a lot of money, so they take advantage of that situation. But I think this is something that maybe you can have a session up or kando. But to close, all of you have heard it directly from Dr. Kombe. The KNAA, Kenya Nurses Association of America Conference is happening September 17th to 19th, 2026 at the Sheraton Baltimore North Hotel in Towson, Maryland. If you are a nurse or a healthcare worker, make sure you sign up, register today. There's sponsor, vendors, join KNAA and share with any healthcare worker in your circle that you know. The link is in the description and pinned in the comments. KenyanNursesUSA.org/payment. So make sure you register before it's too late. $250 right now. It's going to go up to $300 on July 1. Now, this is how we move from the WhatsApp fundraisers to organized solutions.